Ache in the lower back. Lower back discomfort is a typical occurrence that has become a part of our daily lives. In fact, this phenomenon is not new, it has been with us from the dawn of time, with no discernible shift in its prevalence through time. The human spine is made up of 33 vertebrae, including the neck, which has 7 vertebrae, the chest, which has 12 vertebrae, the waist, which has 5 vertebrae, and the trunk, which has 5 connected vertebrae. There is a gelatinous disc between the vertebrae. The spine's construction allows it to perform 2 functions: stabilizing the structure, bearing the body's weight, preventing shocks, and dispersing stresses, while also allowing maximal movement and flexibility of the body. The spinal cord and nerve roots run through the spine, allowing electrical connections to be created between all areas of the body and the brain. Back pain affects people of all ages, but its occurrence rises with age until it reaches a peak in the 4th decade, following which it declines until it vanishes in the 7th decade. Although back pain is widespread and inconvenient in everyday life, it develops as a result of our body's weariness. Symptoms of low back discomfort. Disc herniations can develop in any area of the spine, although the lower back and neck are the most prevalent. In contrast to the middle of your back, they are the flexible sections of your spine. They suffer the most wear and tear because they enable the most movement, resulting in fluid volume loss. Because many people live with some degree of hernia, you may not experience any symptoms if the hernia is tiny or does not press on the nerve. The pain from a herniated disc is usually felt on one side of the body and can spread to the arm if the herniated disc is in the neck, or the leg if the herniated disc is in the lumbar disc. A herniated disc might also cause the following signs and symptoms: minor aches and pains on one side of the body, coughing, sneezing, or moving into certain positions cause pain, a numbing, tingling, or burning sensation caused by a compressed nerve. Sitting causes the most discomfort, but standing, walking, and bending can also exacerbate symptoms. Muscle spasms or weakness that makes it difficult to lift or grasp objects. Problems with balance or lameness as a result of weakness or pain. Feedback is slow. Difficulties rising from a seated position. Inability to maintain a single position for long periods of time. Inability to control bowel or bladder movements. Causes and risk factors for low back pain. The following is a list of the most common causes and risk factors for lower back pain. 1. What are the causes of lower back pain? Disc herniation is frequently the outcome of disc degeneration, which is a steady wear linked with age. Your discs become less flexible as you become older, making them more vulnerable to rupture even with minor strain or sprain. Most people cannot pinpoint what causes a herniated disc, however, lifting heavy objects with your back muscles rather than your leg and thigh muscles can result in a herniated disc, which can twist and spin while lifting. A traumatic event, such as a fall or a knock to the back, is rarely the cause. 2. Lower back pain risk factors. The following are the key risk factors. Weight. The discs in your lower back are put under increased strain by excess body weight. Anxiety. Back problems are more common in those who have physically demanding occupations, and repetitive lifting, pulling, pushing, bending, and twisting might raise the risk of a ruptured disc. The science of genetics. A herniated disc is a condition that certain people are predisposed to develop. Cigarette smoking. The oxygen flow to the disc is considered to be reduced by smoking, leading it to break down more quickly. Complications of low back pain. A disc herniation can compress the whole spinal canal, including all of the cauda equina nerves, in rare circumstances, necessitating emergency surgery to avert irreversible weakening or paralysis. The following are the most common complications. Exacerbation of symptoms. Pain, numbness, or weakness may worsen to the point of interfering with everyday activities. Incontinence or trouble peeing even with a full bladder. Cauda equina syndrome can induce incontinence or difficulty urinating even with a full bladder. Saddle anesthesia. This gradual loss of sensation affects the parts of the inner thighs, backs of the legs, and the area around the rectum that come into contact with the saddle. Diagnosis of low back pain. The following are the most important diagnostic methods. During the physical exam, your healthcare practitioner will conduct a thorough examination. Pain, muscular responses, sensation, and muscle strength will all be assessed by your doctor. Your doctor may also prescribe tests like magnetic resonance imaging, MRI. An MRI is the most common and reliable imaging diagnostic for a suspected herniated disc. X-rays. An X-ray can help rule out other potential causes of back or neck pain. Computed tomography, CT, scans. Herniated discs can migrate into and compress the space around the spinal cord and nerves, as shown by a CT scan of the spine's bones. Myelography. Myelography is a CT scan that involves injecting dye into the spine under X-ray supervision. The dye can identify spinal canal narrowing as well as the site of a herniated disc. Electromyogram. This test is inserting tiny needles into several muscles and determining how well your nerves operate. The electromyogram is used to figure out which nerves are impacted by the herniated disc. Treatment for low back discomfort. Most people's symptoms are relieved in a few days or weeks by changing their activities to avoid painful movement and using pain relievers, and the most common treatment approaches are as follows. Medicines are number 1. The following medications are available. Greater than pain relievers available without a prescription. If your pain is mild to severe, your doctor may prescribe acetaminophen, ibuprofen, or naproxen sodium as an over-the-counter pain treatment. Injections of cortisone. If oral medications do not relieve your pain, your doctor may suggest injecting a corticosteroid into the area around your spinal nerves, using a spinal imaging to guide the needle. Anti-Spasmodics. If you experience muscle cramps, you may be prescribed these drugs, but drowsiness and dizziness are common side effects. Opioids are a type of opioid. Many doctors are hesitant to administer opioids to treat a herniated disc because of the potential for addiction. If other medications fail to ease your pain, your doctor may prescribe a short-term opioid, such as codeine or the oxycodone-acetaminophen combination. However, these drugs might cause nausea, disorientation, and constipation as adverse effects. Physiotherapy is the second option. Physical therapy may be recommended by your doctor to assist relieve the pain. Physiotherapists can teach you how to do positions and exercises to help with herniated disc pain. 3. Surgical procedures. Only a small percentage of persons with herniated discs require surgery. If conservative therapy failed to alleviate symptoms after 6 weeks, your doctor may recommend surgery, especially if you still have. There is a lack of pain management. Weakness or numbness. Standing or walking is difficult. Inability to control bladder or bowel movements. Lower back pain prevention. Although it is not always possible to avoid a herniated disc, you can lower your risk by: lift with good technique. Do not bend at the waist, instead, bend your knees while maintaining your back straight, and then support the burden with your powerful leg muscles. Maintaining a healthy weight. Carrying too much weight creates strain on the lower back. Practicing good posture. Learn how to walk, sit, stand, and sleep with better posture. The pressure on the spine is reduced by good posture. Stretching. If you sit for lengthy periods of time, it is extremely vital to take breaks to stretch. Avoid wearing high-heeled shoes. They can cause your spine to become misaligned. Exercise regularly. To support your spine, focus on exercises that strengthen your back and abdominal muscles. Quit smoking. Smoking weakens the discs and makes them more prone to rupture, thus it is important to quit.